Yeah, I do have to explain to parents because a lot of times they're like, I feed my child so well, I'm doing my best. And I'm like, I know, keep doing that. But unfortunately, it's not just what they're eating, it's what you ate.
Yes.
And what your parents ate. And we have this like epigenetic effect of this poor diet over the years. And it's going to take us a long time to be able to reverse that.
Yeah.
Fluoride. I know, revered by folks in your circles as the big evil, but we'll have a lot of listeners think, what do you mean? Fluoride is something I need to introduce to my children for strong, healthy teeth. Why do we think fluoride is so good for us? And yet maybe there's some counter argument to that. We should be limiting the amount. Another neurotoxin, another potential load. Do we need fluoridation? What's the story?
Well, probably I'll defer to our pediatric person here.
Yeah, so I do, it's scary being a parent and always wanting the best for your child. So a lot of fear mongering, unfortunately, comes from fluoride. And when you go to your pediatrician now at age 1, if you're going to a traditional, they're putting varnish on babies without having them spit. And as we said, anything that goes in the mouth is going in the body. We absorb very, very easily. So, and fluoride is in everything. It's in our food, it's in our water. So we want to limit it as much as we can. And I think one way that we can limit it is by using a toothpaste that's not fluoride, but instead has another way to help mineralize the teeth. I always say I don't like nothing toothpaste, but we can use hydroxyapatite toothpaste, which is a great alternative now, or use something with ionic minerals in it. There's a lot of other ways to make the teeth stronger. And I do, being a mom myself, I'm always like, I know you're scared not to use fluoride because of cavities, but my kids have never had a cavity and they've never had fluoride, their whole life. So there are other ways to do it with eating a good diet and making sure you're getting the vitamins and minerals you need, and making sure that your toothpaste is mineralizing, but in a more natural way where we don't have to risk the possible side effects.
That's great. And Chit, from your perspective, in terms of if we're going to look at nutrition and supplementation, what would be your number one supplement for teeth and bones?
Well, we do a lot of surgery, so we're going to look at the bones, and we want the bones to regenerate as quickly as possible, especially if we're doing implants and things like that. So vitamin D, of course, we talked about this earlier, that I think most people in the United States, and now you're saying even in the world, in the industrialized world, are low in vitamin D, and that's essential for bone regeneration. And of course, it goes along with K. And when we do surgery, we want to make sure that we are getting the best nutrition and supplementation, and putting the patient at the best level of their being able to heal and accept a implant and get the bone to heal around it. Those are really important. Your question, vitamin D is our number one, and I like your idea of sublingual vitamin D in a liquid form. I think that a lot of times we're taking supplements and taking a lot of them, but they may not be absorbing very well.
Sure.
And one of our things is to try and find for adults anyway, the most effective way to get vitamins, nutrients, micronutrients in, and that sometimes is a challenge for people. So we are looking at different methods and ways of getting vitamins in. So, vitamin D, very important for us.
You would agree, Dr. Wood?
Yes, and the K2 as well.
Knits the bones, right?
Yeah. And the teeth, and there's research showing that the teeth will come in stronger with less grooves even inside of them, like those deep grooves, pit and fissure grooves, if we're getting that K2. And then also thinking about our airway helps the jaws grow, and that was another thing that Weston Price found, is like when they have those big beautiful jaws, it's because they're eating that D3K2 every day.
Masticating too, right? Something that we all know is the piezoelectric effect. Well, just to frame this up, I mean, there's really only kind of two tissues, maybe epidermis, but hair and nails that are dead. But bones and teeth are very much alive, at least the center of the teeth. And it relies on the calcium and the magnesium and the vitamin D and the K2, even boron, strontium, manganese, et cetera, lots of different things. But can we, and this is really the question we ponder often on the show the first 7 years, can we, in your opinions, eat ourselves to therapeutic levels? Because I heard you intimate, Dr. Yokoyama, that getting enough vitamin D even from sun in sunny California is hard for the elderly population or even the adult population. But from a children's pediatric perspective, the question really becomes, can we feed our kids enough of what their teeth and their oral health needs, or do we really have to basically rely on supplementation in many cases?
I think we have to supplement that, to be honest. I always try to explain to parents also when they're like, oh, they eat so well. And I was like, well, we're counting on the soil to be good first, and then for it to get into the grass, and then for the animal to eat it, and then for us to eat it, and for us to absorb it. And that's a lot to count on. So I think it's a good, just preventative, let's go ahead and supplement these things to make sure that our kids have their best chance. And like I said, they're forming everything right now. They're growing everything. And if they're missing that, then they're going to have issues.
Starting in utero, and thankfully we've got Dr. Murray, who's formulated an incredible line at Child Life. What are the minimum go-tos if we're looking to have good oral health, good dental health, also maybe even starting in utero for the mothers of prenatal, but at least, into early childhood, the first 7 years, what do we need?
Well, I first, start with what they don't need. So try and avoid the processed foods and sugars, number one. And then, organic, whole foods, wherever possible, whenever possible. But I think organic is at the top of the list these days, has to be understood. And then when a child starts eating, when they first start, 6 months, 7 months old, that's when you can think about supplementing. Apart from vitamin D, which I recommend from birth, and also the American Academy of Pediatrics also recommends vitamin D from birth for every American child. So vitamin D from birth, that's going to give the teeth a great start, with K2 ideally at that time. And then when they start eating 6, 7 months of age, then you add in, a broad spectrum multivitamin mineral, where you get all those other ones, and the macro minerals, calcium, magnesium, especially also for the teeth. At the same time as the teeth are growing, the brain is growing exponentially, especially the first 7 years we talk about. By the age of 7, the brain is 95% the size of an adult's brain. So we've got 7 years to feed that brain everything that it should get. And that's when the omega-3 fatty acids, DHA, come into it. And then I always suggest, vitamin C is the main antioxidant to help protect child from the environment, whether it's metals, plastics, pesticides, other chemicals. The vitamin C as an antioxidant has more potential to help detoxify those than any other single nutrient. So multivitamin mineral, omega-3, vitamin C, and the vitamin D, and you have your bases covered.
Set the stage. What does pediatric oral health look like? And now what I'm referring to is, oral hygiene care. And when does that start? I mean, I think that's not really talked about enough outside of your office, both of your offices, really. But what does that look like? When do you start? When does a mom really care about starting to floss a child's mouth?
Flossing as soon as the molars are touching, which is usually sometime during year 2. But really, oral hygiene should start at birth. I think that it's helpful to get just a cloth in there to wipe the gums. The baby gets used to having a finger inside their mouth. Otherwise, they get their teeth and they're like, wait, why are you touching inside my mouth now? What changed? And then also just to disrupt any sort of film that's there. Right. But once the teeth are there, we need to be cleaning. You don't need toothpaste yet, but we just need to be wiping and making sure that we're getting in there. And like I said, a big part of the oral health of the child is the oral health of the primary caregiver. So making sure that they're have good healthy mouth too, and then we want to be using a toothbrush every morning. For kids, I say after breakfast because they're typically eating stuff that's getting stuck there. Every night we want to floss first and brush, and we need our parents helping them. So the studies say until age 7 they don't have the dexterity to reach the back of their mouth, but in my practice and my own children, I think it's a lot later than that. So
Yeah, well, yeah. And in the adult population, I mean, we're hearing more and more about this correlation between P. gingivalis and Alzheimer's. You know, anything with itis, which is the periodontitis we're getting into now, of course. Anything with itis is not a good thing. It means inflammation. But you have a couple of thoughts around oral hygiene. Well, so I guess if we establish it in the younger years, it's going to extend into later age. But keeping good oral hygiene.
Yeah, for adults, a lot of times we find it's episodic. Yeah. So there could be a time when you're lowered resistance. And at that time, you may need to come in to have a dental hygienist help you with cleaning your teeth. And there are times when people actually psychologically or just physically are at a lowered part in their life, and we see so much damage, a lot of stress, and then you might get some, like you said, gingivitis or periodontitis that is episodic. It starts to wear away at the gums, and you get some recession. And then, you feel better, and now you're healthier, and but still you have some recession that never comes back. So we want to emphasize that during the times of extreme stress or possible problems that you might have in life, and lots of times these are ongoing, you may need to come in a little bit more frequently. And we used to say, every 6 months or once a year, that type of thing. But we're finding that a lot of people need more help.
Sure.
And the hygienist is there to really help you on that path of health.
You know, and one of the reasons I bring this up is because hygiene in the dental practice was literally the founders, that group, that body of preventive care. Mm-hmm. I mean, this is really interesting to me that, it started with oral health, the first practice ever that looked at an ounce of prevention's worth a pound of cure, right? Mm-hmm. And in your clinical practice, Dr. Murray, I know you relate, you talked about it at the top, oral health to digestive health, the microbiome connection. What do you recommend early moms think about when it comes to the microbiome supporting that? Basically what we refer to affectionately as from mouth to anus.
Sure. So in the same way that, you can focus in on the teeth, vitamin D, K2, calcium, magnesium, underneath that and underneath everything in the human body is the microbiome. So that's really the engine that drives everything. And if we can keep that in good shape, keep that healthy, then everything else is going to reflect that. So at the same time as, we're looking at the supplements for the teeth, for the bones to grow, for the brain to grow, then we think about the microbiome, and that's two parts to it. One is keeping anything out that doesn't belong there. And then the other thing is keeping a diverse, microbiome, all the good beneficial bacteria present. So that's where we can look at things like colostrum, probiotics, prebiotics, to keep that microbiome in clean and good shape and diverse. Diversity is really the key to the microbiome. Diversity. And the underlying layer of that diversity is the food and the fiber that we eat. And then on top of that, we can add the probiotics if we wish.
In your pediatric population, because antibiotics happen, their infections happen, ear, nose, throat, and upper respiratory, et cetera. But it does wipe out this population on a regular basis. And everyone, when they talk about and hear about microbiome, they think gut. But it does extend itself into the oral cavity too, right? Are you having conversations with parents as to how to replenish the systemic gut and oral microbiome?
Yes, definitely. And same as what Dr. Murray said, is food first. But if you have gone through some antibiotics, or even you had a really bad viral infection that just disrupted everything, or, a candida infection, we want to support, by taking a gut probiotic, but I also encourage an oral probiotic. There are different strands that we're looking to be inside the mouth. I say they're like our little soldiers in there that are fighting off the bad stuff so that the kids can understand. But anytime we're starting to see signs of decay or gingivitis, we want to help support that oral microbiome. And there are a lot of actually great products. Now there weren't as many when I started, but now there's a lot of great options for oral probiotics that you can chew right before bed, and just let them sit in your teeth and grow while you're sleeping.